Hey everyone, thanks for tuning in to RGV Community Health Hour here on Vaquero Radio. As a reminder, the views expressed on RGV Community Health Hour are for informational purposes only and do not constitute medical advice. Be sure to consult your primary care provider for all your healthcare needs. On today's show, I have Dr. Aaron Manusov, recently retired from UTRGV, but still here to drop a bunch of words of wisdom on us and talk to us about his experiences and give us some insight. So thank you for coming on the show, Dr. Manisov.
Thank you, Ricardo.
Yeah, of course. So the way I like to start out my shows, just give us a little bit of background on yourself, where you grew up, where you're from, your educational background, and kind of your journey to how you ended up at UTRGV.
Great. My father was in the military, so I grew up in the Air Force. He was a pilot. I lived all over the world. Ended up in California for undergrad, majoring in psychology and biology with a minor in Chicano studies. I went to the military medical school, which is Uniformed Services University in Washington, D.C., and did a residency in family medicine in California. And my first assignment was in Japan. After that, I deployed quite a bit. I taught in our family medicine residency training at our school. And I was part of the combat casualty, so that I deployed out to different various areas as part of my job. When I got out of the military, I went to civilian. I went to North Carolina, and I practiced rural medicine. And then after that, teaching at Florida State, and eventually coming out here to help start the medical school back in 2014.
Oh, cool. And so did you get recruited to come down here, or how did that happen?
Well, I was teaching at Duke in their family medicine residency, and I got a call, said, "Do you want to go to start a medical school in Edinburgh, Texas?" And I said, "Edinburgh, Texas? Where the heck is Edinburgh, Texas?" And it turns out that when I was in Florida State, I used to bring my students to do a border medicine experience, and of course I came here. I just didn't know it was called Edinburgh, Texas.
Mm-hmm.
And so I came here, and I really loved my job over there. But how often do you get to help start a medical school? So actually, that's what my wife said. How often do you get to start a medical school? So I came here, and I was with the first dean, Dr. Fernandez. And at that point, we all had multiple jobs. I was assistant dean for clinical education, chair of family medicine, and I was program director for 3 programs. So it was quite busy until we started recruiting people. And then after that, I've never lived any place longer than 3 years in my life, probably because of my military background. But I've been here this is my 11th year, so I never
Wow.
thought I'd be here for 11 years. In fact, I didn't even take the retirement thing. I said, no way I'm going to be here for that long. But turns out I am.
Wow. Yeah, that's really interesting. So when you served in the military, was that active duty status or?
Yes, I went to the military. So for University Services University, Uniform Services University, you get accepted first into medical school. Then after that, you get accepted into the military. And so I was active duty as a second lieutenant through medical school. When you graduate, you are a captain, and then you go to you stay on active duty, and do whatever the military tells you to do.
Yeah, that's the nature of that beast for sure. And so you mentioned traveling around, for deployments. I imagine those are like OEF, OIF, like Iraq, Afghanistan, or even before then. I imagine.
Well, during those, I actually stayed and backfilled for this. I went to a bunch of different areas. Bosnia, where I set up I didn't. Well, I helped set up the telemedicine for the theater, and so we deployed to Bosnia. a total of a year off and on. And then the other deployments were, deployments to Philippines, to Korea, and places like that.
So how, when you got to the Valley and UTRGV, was it UT Brownsville then? Like right before that transition of UT
Yeah.
Brownsville? Yeah.
So actually, I was hired by UTESCA in San Antonio because we didn't have we had Pan Am here, and I actually worked with Doctors Hospital Renaissance, and so. And then we started off 4 residencies. We started off internal medicine, family medicine, surgery, and OB, and that's through Doctors Hospital. Once we got those started up, we then fused UT Brownsville with Pan Am, and we became UTRGV. And nobody got their first paycheck because it was a quite a tumultuous.
Transition.
Yeah. Even the president. I don't think the president even got a paycheck.
So I'm just kind of curious to hear your journey here because I know that most of our department got brought down from San Antonio in the Texas Biomedical Research, or what is it called? Texas Biomed is just how they always shorthand it. So, how did you end up working with them? Because, obviously, I guess because they became part of the School of Medicine and they needed an MD to do some of their work, or how did that all play out?
Yeah, that's a good question. So I had done a lot of with the curriculum development. I had a large grant to start a Colonia Care a project with the Unimobile. I started a treatment center for triply diagnosed kids aged 12 through 17 who were diagnosed with a appetitive drive, usually drugs, a mental illness, and also medical illness. And we had about 400 kids there. We had about $3.4 million in funding for our colonia. We used the colonias as a way to train our students and our residents. And then also provide care to a very at-risk population. And when we had that going, the students, the residents loved it, and we were able to go out to the colonias, and I think we were going pretty much every day to a different colonia. And
Wow.
the way I did that was I would get the faculty to precept, and then the students and the residents would go along with them. And then one day, Dr. Williams Blangero and Dr. Blangero invited me out to dinner. I thought we were just going as friends, but apparently they were recruiting me. I'm not very smart. I didn't realize that. And I knew nothing of genetics. It was pretty funny because when I was an undergrad, I had to drop out of genetics because I didn't want it to hurt my GPA. And my statistics was equally as bad. But I do know medicine, and I had a lot of contacts in the community, and it became a really nice marriage. We working with the department has been probably one of the highlights of my career. I still continue to practice full service family medicine, so I did inpatient medicine, outpatient. I taught still, and I worked in the department. Eventually, I started to slow down and make my landing towards retirement. But I learned so much. We were able to publish. We were able to do some really incredible research, and then we were very fortunate to be able to recruit amazing students like you.
Thank you.
Into our PhD program, which Dr. Curran and well, everybody, but Dr. Curran's the leader of it, and
Mm-hmm.
she's amazing. But she's able to recruit, and as you know, you were the first class, so you were our guinea pigs.
Yeah. Yeah, it's been fun being experimented on, to say the least, you know. But that was kind of what we all kind of came in knowing, like, hey, you're the first students, and like the first of anything, it's a learning process, and you're just gonna have to roll with the punches, you know, because it's gonna be, you know,
Mhm.
some rough sailing some days, and so
And you
yeah.
all did really well. I mean, the research, your thesis that you're doing, the stuff. I mean, it is the future of medicine for sure. If you don't know genetics in medicine, you're going to be left way behind.
Mm-hmm.
And so the things that you do will definitely shape the future of what we. I look at medicine, I look at healthcare completely different now since I've been in the department. I think for 6 or 7 years now. It took me that long to just to figure out the words that the PhDs use. But it is the future of medicine.
Mm-hmm.
So I really encourage people to. And I know the medical students are doing that, but it'll change their life and the lives of our patients.
Yeah, for sure. And so did you, you know, you mentioned publishing with the department and all the awesome research that they've done over the last, you know, 7 to 10 years since moving down from San Antonio. And I mean, even while they were up in San Antonio, right? Because they've had the San Antonio Family Study or the Mexican American Family Study going on for quite a while now. And so before you kind of partnered up with the department, the human genetics department, just for clarification, um, were you publishing much or just writing? Because you had mentioned you had that grant to do the work in the colonias. Was it mostly just grant writing and doing work, or was there a little bit of research and paper writing while before the department? Because I know obviously over the last few years y'all have worked heavily together to crank out papers, and of course you're involved in a lot of that. So was that something that was you were doing before partnering with the department, or it really ramped up obviously because it's a bunch of scientists having to publish their
Yeah.
findings and their
Well,
research?
I've always wanted to be in academia. Even when I went to medical school, I wanted to be in academia and full service academia too. So I love medicine. But I think medicine, not but, and I think medicine and research. And teaching go hand in hand. All three of them is what I really concentrated. I'm a family physician, so we tend to be like everything and spread all over the place. And that has been a little bit of a thing that I've had to focus more because uh, if you're going to do research, you need to have a focus. But I wrote a lot and I published a lot prior. Some of it was research that I did. It's a different kind. It's academic research and educational research.
Mm-hmm.
I presented at our the AAMC, which is our American Association of Medical Colleges. I presented in Scotland,
Wow.
Mexico, Spain, multiple different areas on integrated care. So I did a lot of that. So I was already doing research. Is I think one thing that Dr. Williams Blanjero and Dr. Blanjero really, I have the clinical experience and I did have the research experience. I still have a hard time understanding the statistics that we do in our department. I know enough that I can talk about it, but don't ask me to do it. I look to you guys, all the students, to help me do that. Yeah, I started out doing a lot. I've always loved it. I think being inquisitive, it makes you a better physician. It makes you a better researcher having that. And my big thing was I wanted to make a difference in the valley. I wanted to help change. We have, as you know, we have the highest number of patients with Alzheimer's in the nation,
Mm-hmm.
upwards to 20 to 40% of people over age 60, which includes me, unfortunately. We know we have 32% of us have diabetes, 60% of us are obese or overweight. And so we have some huge challenges, but we have such a resilient population, and we have people who just work really hard, and the students that we put out, growing up, maybe they're the first person to graduate from even high school, much less college or medical school, and maybe they didn't look so great on paper when they started, but they are amazing. One of my students grew up in Dana in a colonia, and she did amazing during school, and now she's in a cardiology fellowship in Houston. They told me that she's the best fellow they've ever had.
Wow.
And so these are people, who didn't have a lot growing up. They had to go to McDonald's to get internet. They had to. They didn't have, but they had this resilience, and the teachers put their all into teaching the kids, and so it's really a phenomenal place to live, and it's a great place to practice medicine, and it's also a great place to teach not only medical students but the PhD students, because we have so many, unfortunately, we have so many diseases here that, and I know the work that you're doing in pollution and things that we're exposed to, like the exposome, is going to change the world.
Yeah, no doubt. It's really remarkable to be able to talk to others in the department, especially Dr. John Blangero, because, I mean, he's just, with his ability to do statistical genetics and just know how to, stuff that they're working on in the department, it really blows me away in terms of just what they're able to, there was one of the other PIs in our department, his name is Dr. Vincent Diego. He basically I can't remember exactly what what the disease was or what the situation was, but I just remember them opening up a map that was like latitude and longitude, and based on the statistics that they did, they were able to identify geographically which regions were most susceptible to whatever it was, or were already experiencing that disease propensity, in just high numbers. And I was just so blown away. How did you even get from that data to a latitude and longitudinal map that will basically show you which regions, statistically could have worst cases of whatever it was, or because I can't remember the exact, because this was during my coursework, which was 2.5 years ago at this point. But yeah, so it's been really remarkable to see all the different things that they do, traveling the world, going to Nepal, Brazil, and Egypt. Egypt as well, right? Did they?
A little bit in Egypt.
Yeah.
But Nepal, Brazil, and Alaska they did. And they did some, field work. They were out there. We recently went to Morocco looking for opportunities to partner over there we do something that not very many people do. We do family studies, as you mentioned. And so we recruit one person with the illness or whatever we're looking at, and then we recruit family members around them who are unaffected. And that concentrates genes that, if there are any gene mutations causing all these, this incredibly high prevalence and incidence of disease, that we could capture them. And then Dr. Blangero and Dr. Vince Diego, they have this, and also Dr. Marcio Almeida, they have the statistical knowledge, and they've developed statistical tools that most researchers don't even know about. And I know that Dr. Blangero is one of the top 100 students in the world, one of the top scientists in the world. I think he'd think himself as a student too, but he's been able to isolate mutations that might be the reason. And with that, we're publishing a paper right now on a gene that we found that may be responsible for fatty liver disease and Alzheimer's, the
Wow.
link between the two. And so with that, then the next step, of course, would be, doing clinical studies where we can see if we can block those or upregulate them,
Mm-hmm.
that we can either prevent or cure. So, like I said, time-changing research.
Yeah, for sure. And with that, we're going to take a quick music break and we'll be right back. So stay tuned, everyone. Thanks. All right, everyone. Thanks for staying tuned in. Back on RGV Community Health Hour with Dr. Aaron Manusov. Okay, so another thing I was curious about, you were, like you said, especially early on, stretched thin with directing all these different like departments within the School of Medicine. And I know here recently, you have your days on and off when you were actively a part of our human genetics department. You had your certain days where you were with the School of Medicine and certain days where you were, doing your SpaceX thing, and then certain days with us. Was that split 50-50? Like, was that, half your time with us and human genetics and the other half School of Medicine, or?
Well, as you may know in academia, when you're one FTE, it really means you're three FTEs. The way I did it was I worked 2 days or a day and a half, usually 2 days, in the ION with work doing research on Alzheimer's with Dr. Maestre. I did 1 day a week at SpaceX, and that was my clinical time.
Oh, okay.
And then the rest of the time was here in the department. Before, maybe about 2 years ago, I still did full inpatient with the Knapp Family Medicine, and I taught over there. And then as I told you, as part of my wind down, I stopped doing that and concentrated more. And so, depending on how much coverage I had with grants, I would, spend time doing whatever I need to. I was pretty much covered. Well, not pretty much. I was covered 100% between my clinical work and my research and grant coverage. I was paid or covered by all that. So, and just as a family physician, I'm pretty good at balancing things. And then, of course, I love being with the students. So the PhD students will often come by, and I like to help them and mentor them. I still was a mentor for the School of Medicine all the way up till this October. So I mentored the medical students through, not all of them, but through the School of Medicine. I also helped out with I worked with the College of Education. I worked with the psych residency, and I worked with the podiatry, School of Podiatry.
Oh, cool.
So I've always liked to do things. My biggest thing is I like helping other people, and that makes me happy. So.
Yeah, that's definitely one of the more gratifying parts of this work is just being able to work with people from the community and just kind of see how everything is transitioning from, especially with all the stuff that UTRGV is doing, all the various, like you mentioned, the podiatry school. I know they have an optometry school coming up. I actually just met on Saturday at the football game the guy that they recruited to come down and start it all. I can't remember his name. My phone's recording right now. So, but yeah, I gave him my flyer and I invited him to be on the show. So hopefully he can come on and talk a little bit about the programs they're gonna offer, and it's not gonna just be because obviously they're gonna start some kind of academic side of it and train students and get them involved with the optometry stuff. But I mean, it's just literally like full on force, like a medical just force of just everything you could ever imagine, from like our genetics to the medical school and all the stuff, the various things they do. And the neuro, what is it? The Neuro Institute, the neuro.
Institute of Neurosciences.
Yeah, yeah, that's fairly new, isn't it?
Yes, it is. Uh-huh.
Yeah, so it's just remarkable, everything that UTRGV is doing to help kind of parse out what's going on down here with all these, high propensity of and incidents, like you said, of these various diseases from fatty liver to Alzheimer's and other dementias. So going back a little bit to the colonias, what was something you'd say that you learned in terms of like, because you mentioned you would come down here when to do the border kind of medicine. And what was kind of like a more eye-opening kind of experience of like, hey, I had already come down here to do some of this border health, but now I'm down here living down here full time, and I'm more. You said at one point you were going into the colonias like every day.
Yes. We sent the van in. Yes. Hmm.
Okay, and so.
Unfortunately, you don't get paid to do that, and so we worked on grants. And when the grants ran out, I was not able to, have some source of income, which was my failure. It was very. Being practicing all over the world. I've practiced in the Philippines. I've practiced multiple areas of with poverty and everything. I'm drawn to doing that type of work. I've always worked in free clinics, just as part of my service. But coming down here, one the people who live in the colonia are very friendly. They're very thankful. They're very like I said, resilient. Some of the things that they suffer through is, they don't particularly look at it as suffering.
Mm-hmm.
When we first started, the one colonia we started in was known as a two police car colonia. Because of the violence in the colonia, and that has changed. Well, it changed back then, and it's even gotten much better. And it's just an opportunity, and it's a great way of teaching. I can teach a person to think. I can teach medicine. I can teach. But it's sort of hard to teach compassion and
Mm-hmm.
professionalism and loyalty and integrity. It's hard to teach that. And working in the colonias, I think one we recruit for that. For our students, we recruit for people with those qualities. But then you put them in the colonias, and they just blossom. So not only is it great for the people who live in the colonias, it's great for our students who it makes them a different kind of physician, the kind which I think is the most important. So we put out the physicians. The same thing with the PA program with Dr. Frank Gambris, one of the best PA programs in the nation, and he recently retired too after an amazing career. And creating a graduate. We have a school of nursing too
Mm-hmm.
here, which is training people, and then I'd love to have everybody stay here, but going out and practicing other places where they may be. I mean, it's not even only in the United States; it's on all throughout globally that we have these issues, and we have wars, we have borders, we have poverty, and so we train these people, students, learners, to go out and actually serve other people.
Yeah, that's one thing. For me anyway, I hope one day, having served in Afghanistan in the military, and they always talk about the burn pits for veterans and the exposures, like the environmental exposures that we come across when we're deployed. Um, More famously, the burn pits, in terms of the more recent Iraq and Afghani, theaters. Um, but the thing that I reflect on now and my experience in this department is like, it's not just affecting veterans, right? It's affecting the local communities and the population there. And so, a full circle moment for me, and especially learning that this human genetics department travels the world to do the family studies. I would just love, whether it's a family study or just looking at exposome and exposures and taking swabs and just getting their DNA to see like, hey, what's going on over here in terms of maybe a weird, some kind of symptom of burn pit exposure.
Right.
But I would just love to be able to one day full circle go back to the place I went to go, fight a war, right? Like to go seeing them as combatants. Not all of them, obviously. You have the civilians that are not seen as combatants by most of us anyway. But yeah, I mean, it's just for me, it'd be really awesome to be able to go back one day. And I know as obviously it's always going to be a dangerous place, not necessarily because of the people, but just because it's littered with landmines. It's because when the Russians were there, and that's actually a big part of the danger that we were exposed to, and that's how we lost a lot of the men that we served with was just them stepping on landmines that were just left there from the 80s. And so yeah, it's really remarkable stuff to be able to be a part of and to learn about. And that in that same sense,
Make a difference.
yeah, it's just so remarkable to know. I'm sure I can't remember. Oh, whenever we were taking y'all's rotation with you and what's her name?
John?
Yeah, with John and yeah, and of course with Mary Beth, right? And yeah, it was just an amazing rotation and being able to learn from you all and the work that you all do and going out to the colonias and being able to actually go out. I think it was Alita's parents that we went to,
Yes.
right?
Uh-huh.
Yeah, that was a lot of fun. It was good training, of course. It was kind of simulated training because, it wasn't kind of, I think it was because the people that we had originally planned to go see, it kind of fell through at the last moment. But yeah, it was still really fun to go as a class, like a field trip, like almost like a class field trip, and just get a small snippet of what it's like to do in terms of doing it for like the real research setting and collecting the data in terms of what do you call like the questionnaires, like questionnaires of
Surveys.
yeah surveys.
It gives you a different, it gives you a little different perspective. As you know, being in the military and traveling around, you've seen people all over the world, and
Mm-hmm.
some people never leave the street that they're living on, and so they listen to news, and that's where how they make all their decisions, which may or may not be such a great idea.
Yeah.
And you find out that the world is big place and it has all kinds of things, but there's a lot of commonalities.
Mm-hmm.
That people are grateful for help in general. Obviously, during a war, it may not be so, and then people suffer. There are people who suffer, and not only at the time, but also they suffer through, generational poverty
Mm-hmm.
and all the things that go with that, and epigenetic changes from those which are transferred down. It opens up your eyes. So sometimes sometimes I wonder if it's just sitting on your street your whole life might not be a little bit more peaceful than realizing that the world is a tumultuous place.
Yeah. Yeah, and for another big eye-opening experience for me, when I deployed to Afghanistan was just seeing how everybody that I deployed, not everybody, but quite a few people got sick for various reasons when we got to Afghanistan.
Yeah.
And it's just like, it's because it's a whole, now that I know about like our gene environment interaction, like it's just like, hey, you're breathing different air, you're drinking different water, the food's going to be different because it's getting shipped overseas or wherever it's getting shipped from to go out to the middle of nowhere, Afghanistan. And so it was just it's kind of weird to reflect on now that I know more about gene environment interaction, to know like, wow, it's kind of weird that a lot of these guys got sick right away,
Yeah.
just from the deployment itself, before they even went out to, the forward operating bases or the combat outposts. And of course, give them a couple weeks and everything kind of starts to go back to normal in terms of,
You always get sick when you first go.
Yeah, I guess that's the nature of that beast.
Yeah.
And for me, what blew me away was just that the waters that they had us drinking were just plastic, pallets of this plastic water out in the sun, and you
I
could
know.
just taste that chemical leach. And
Maybe
I was,
buffalo.
yeah, no, buffalo probably would have been preferred. Maybe not would
I
have
know it
tasted.
tasted pretty tough.
Oh yeah, yeah. Water buffalo water was never the best, but man, there's nothing like that. Just plastic bottle of water, just chemical
I
leach
know,
taste.
and it
So
tastes terrible.
yeah, it was just so bad. But has there been any, in that same sense, has there been any of your experiences when you were deployed that you reflect on now that you know more about like gene environment interaction, and especially like, just another aside is like whenever I got back, and it's been years since I got back from Afghanistan, I got back in 2010. Um, I was like, oh, burn pits. Like, I feel so bad for the veterans who are exposed to burn pits. I was never around burn pits. And then I was reading through one of my journals that I was writing while I was out there at the combat outpost. And I was like, oh, and then I volunteered to watch over this burn pit. And I'm like, oh, what? Like, I actually, and then all these memories came flooding back. Like, oh, wow, I was really there, like babysitting. And it wasn't like a huge, big base burn pit. It was just like right there at our combat outpost, maybe
Right.
20 guys there at most, or maybe like 10 guys, or, maybe 10 to 15 from, our American forces, and another 10 to 15 of the Afghan National Police, the ANP. But yeah, I was just like, oh yeah, I was never around burn pits. And then looking through my journal, I was just like, oh wait, I guess I was right there next to it. And, thankfully and hopefully not too heavily exposed. And I learned growing up on the ranch, like no matter what's burning, you should just be upwind from it, right? Like don't just be letting that smoke smother you. Um, but yeah, so is there anything that you can reflect on later, just
Well,
just quickly off the top of your head?
those things. I mean, obviously, I was around them. Um, I didn't take. It didn't bother me that much. I was really. I look back and see. Well, one thing when I did my training up in north of Germany, I've never been so cold in my life.
Oh yeah, I'm sure.
But and then getting to Bosnia, the same thing. But um, it's just the way people live,
Mm-hmm.
and they live a completely different life than what Americans. We have a really nice life. Right now we have a lot of problems, but in general, we have a pretty nice life. And so I look back at that and see what people live through, especially if you're in a during a conflict where there's all kinds of things happening, and everybody's being exposed to a bunch of things. And
Mm-hmm.
as everybody who works in the chow hall and everything are locals,
Mm-hmm. Yeah.
serving you and everything like that. And
Yeah, I mean, a big part of it too is just learning through this department. Of course, they talk about um, traumas, whether it's PTSD or whatever the case is. Obviously, like those local communities are going through their traumas of being in like I right now it's such a terrible situation with Israel and Gaza,
mhm.
and then so many of those people in Gaza are innocent bystanders, and they really have no safe place at all, no food, no water. It's like, so even though they're like, even if they had the cleanest air and the cleanest water and the best foods available, like just that constant like stressor of knowing like, hey, a bomb can just fall on me at any time. It's just really it's one of those psychological factors that really can affect your health and your well-being. And then now we know, of course, the social determinants of health.
And their effects, yeah.
Yeah, and so I always just kind of, it's hard for me to, especially with the experiences that I've had, I can put myself in their shoes pretty easily,
Mm.
and it terrifies me to just think like, man, that's just high alert all the time.
Also,
It wears on you.
pretty much, I hate to say this, but ruins their life. All these kids and everything,
Yeah.
and it's on both sides. There are people who are suffering. I was in Philippines during their civil war, and I remember
Wow.
the fighters running across the street, and I was on the street. Thought it wouldn't be a good idea to stay on the street,
Mm.
but I mean that's what's people, that was what their daily life was. They
Mm-hmm.
were used to having gunshots, killings, and people get used to it, which is super sad.
Yeah.
If you look at all across the country, the world, they get used to it. That's the way life is.
Mm-hmm.
You're supposed to go through life where your house is bombed, and
Yeah.
it's a shame. And we do it our best in our little environment, in our little, we try to make the best down here. We might try to make it better and grow, and to be, so people don't have to experience those traumas. And it's hard because especially when people are being deported, and everything. It's very difficult. But I think humans are resilient, and hopefully people continue to help each other, and compassion, and realize that things like this are not right.
Yeah. It's I've read a book recently called "The Splendid and the Vile," and it was World War II. It was a book about World War II and Britain's involvement before the U.S. forces got involved. So it was really interesting reading about World War II history without America involvement, because obviously living in America, we learn about Pearl Harbor and D-Day and all these events that occurred that were obviously with Americans involved with them. But just to hear the stories, and it was such a beautiful book because they just talked about a lot of just, the book was written mostly through journals people were keeping, and they would find these journals and they would be such amazing stories. They're like, okay, we need to like compile all these stories and turn it into a book, what the author did. And it's just, like you talked about the resilience of people, especially in Europe in those times whenever the air raid sirens would go on or go off, and they would go to their underground safe spots. And of course, they would have their tea time, right? Because that's what Britons do. And and they would talk about having their tea in the bunker and having to stay down there, and then actually just, you know, having to re-steep their tea bags because, like, hey, we don't know if we're going to get more tea, and we can't really leave this bunker, so we're just going to keep reusing these tea bags. And just the different perspectives from a different country, and it was really kind of eye-opening
Yeah.
with that as well. But with that, we're going to take another quick music break, and we'll be right back, everyone. So stay tuned. Thanks. All right, everyone. Thanks for staying tuned in. So we have about 5 minutes left, and I want to read off this flyer that was given to me from Texas Oncology real quick. It's the Transform Your Fight by Angels Sin Fronteras. Saturday, October 11th from 10 a.m. to 1 p.m. Each registered warrior will receive a free Feel Beautiful package that includes a wig of their choice, a small makeup kit, and a headscarf. Each participant can bring a guest. No children, please. This event is for patients in cancer treatment and individuals with alopecia. Patients of all cancer types are welcomed. So, yeah, be sure to check this out. Let's see if there's a website here I could share. There's a QR code. You can probably find it by going to the Texas Oncology website. Um, yeah, just Google search Texas Oncology because there is no .com, and I'd hate to give the wrong information out. So Google search Texas Oncology and look up the Transform Your Fight by Angels Sin Fronteras. All right, Dr. Manisoff. The way I like to wrap up these shows is basically just give you the mic for the last 5 minutes or so, and anything you want to share about life and experiences, or UTRGV Medical School or School of Medicine. Um, yeah, anything you want to share, anything you have coming up, any music shows, or shows your band's playing at, or however you want to use these last minutes, it's up to you.
Well, great. Thank you very much for inviting me. I enjoyed. I think you do a good service for the community, for us to get to know what's in the community, who's working in the community, who is fighting for us. I don't think everybody realizes that there's such a group of people that really want to serve and to help other people. And so I appreciate you doing this, and also the research you do, and the support that you give our community. Um, I guess so. When I started doing research, and I did a fellowship in academia. My research was on what made people happy. At the time, physicians, depression and physicians was still is was a big problem. Taking your life was a problem. People getting burned out, but I noticed that there's a lot of people who were physicians who were very happy, and so instead of focusing on what makes people depressed, I focused my research on what makes people happy. And over the last 30, 40 years, I've continued to do that. I think we could all be very unhappy if we listened to the news every day and if we talked about all the shameful things that are happening in the world. Or we can choose to be happy and make a difference in the world for other people. Yeah, like I said in the colonias, there's things that I would say, oh my gosh, how can you even survive like this? And yet they were happy.
Mm-hmm.
And they were resilient, and they were able they came to a new country. My family immigrated from the Ukraine here, and my wife's family immigrated from Laos. Very difficult times when you come across very hard, first generation especially. Or you can really focus on the happiness in your life and people around you, making yourself happy. So I guess my leaving thought would be let's make ourselves happy and let's make each other happy. Doesn't mean you can ignore all the things in the world that are, evil. But it does mean that you can focus on the things that make things good and beautiful and happy.
Yeah, those are great things to share. And I've mentioned it on our show before, that it's really easy to beat yourself up, and people are really good at it. We're so good at beating ourselves up, and it takes proactive measures to change that mindset. Like, even if it's not a long-term thing, just the positive affirmations. Just like for me, I have so much imposter syndrome being a part of this department and in this program.
You shouldn't.
That whenever I commute so much that on my drive, at some point in my drive, I'll turn off the music and just say out loud, I can do this. I can do this. I belong. I'm smart enough. I'm capable. I can do this. I've done it once. I can do it again. I'm capable. And I just literally drive and just repeat those words for like 10 minutes. And at some point, I start to feel better. Like, you just start to physiologically change and you feel something.
Absolutely.
And it's just like so important to not beat yourself up and try to give yourself those moments of like self-affirmation, just because you are capable and you are, capable and able to do anything you set your mind to.
You can be happy. Yeah,
Yeah.
even in unhappy times, you can be happy.
Mm-hmm.
Certainly you shouldn't be concerned about the imposter syndrome. You're incredibly talented, but I'd say that's probably true for everybody.
Mm-hmm.
That they like you said, they beat themselves up, and they instead of realizing what the things that they do for other people, and
Mm-hmm.
the more we do for other people, the more we are happy, and the more everybody around us is happy.
Yeah, no doubt. And then the more we're happy, the more we can kind of radiate that positivity versus like just, because it's fairly easy to tell when somebody's dragging around a dark cloud with them, and then it kind of brings the mood down of people around them, and it kind of perpetuates from there. So it's important to try to stay happy and try to think positive. And that's actually what changed my life and got me kind of on the track that brought me here to UTRGV, was just being in one of the worst depressions I had ever been in. And then one day, mostly because of my daughters, one day just deciding like, I need to stop being so negative and stop waking up every morning, coming downstairs. It was just like, oh, I hate life. I hate the world, like just terrible thoughts, terrible thinking. And I was like, man, I just need to fake it till I make it. No long-term plan. Just like, hey, just need a couple of weeks of being positive and coming down with a smile, coming downstairs like happy and positive and smiling rather than slugging myself down, being depressed, just looking for reasons or excuses to hate everything. And it really did change my life. And yeah, so thinking positive and trying to, think happy thoughts, I guess you could say, right? Yeah.
Absolutely.
Yeah, and it'll literally make you fly like in Peter Pan.
Yes, absolutely. I agree.
Well, thank you so much for your time, Dr. Manisov. I'm so glad you were able to come on the show. I've been trying to recruit you to the show since last semester, so I'm glad you were able to come on and have this conversation and tell us a little bit about yourself and of course give us your words of wisdom. So thank you for coming on.
Thank you for having me.
All right, everyone, that's it. This is DJ Kalicha Kid here to remind you to stay curious, stay healthy, and let's thrive together, RGV.